Did you know that drinking lemon water before meals can help reduce blood sugar spikes? Welcome to Diabetic 365. In today's video, we're diving into the ultimate morning drink for individuals with diabetes. This simple concoction can help control blood sugar, improve digestion, and ensure your body's processes run as smoothly as a perfectly tuned orchestra. It's crucial to watch the entire video, as we'll share essential tips for preparing and consuming this drink correctly, especially since it's acidic. Following our instructions will help protect your tooth enamel from potential damage. Get it right, and this blend of natural ingredients can work wonders for your energy levels, overall well-being, and future health. We start with warm lemon water, a fantastic way to cleanse your digestive system and support your body in numerous ways. Lemons are packed with vitamin C, a powerful antioxidant that combats oxidative stress, a significant contributor to diabetes complications. But that's not all. Vitamin C also improves glycemic control and insulin sensitivity for people with type 2 diabetes. Lemons are also rich in flavonoids, potent antioxidants with anti-inflammatory properties. Refined carbohydrates like bread, pasta, and white rice are often challenging for diabetics because they can cause rapid blood sugar fluctuations, inflammation, and other issues. However, research published in the European Journal of Nutrition found that consuming lemon water before a carb-heavy meal reduced blood sugar spikes by an average of 30%. This groundbreaking study monitored blood glucose concentrations over 180 minutes and showed that, compared to those who drank plain water or black tea, the lemon water group had a 30% lower peak glucose concentration, and that peak was delayed by over 35 minutes. This is fantastic news for anyone managing blood sugar. Lemon water achieves this by raising the pH level of the meal, which slows down the digestion of starch. Fat loss and diabetes prevention. Bioactive compounds in lemons are particularly valuable for fat loss, which is crucial in managing and preventing diabetes. Excess body fat, especially visceral fat, the deep fat around abdominal organs like the liver and pancreas, significantly impacts insulin resistance. Lemons trigger the production of carnitine, a molecule that helps your body burn fat for energy. Additionally, the flavonoids in lemons can improve metabolism and accelerate fat loss. Glucose. Flush and appetite. Control, drinking lemon-infused water helps dilute and flush out excess glucose from your blood. Making this a routine can promote feelings of fullness and hydration, leading to better appetite control and reduced calorie intake. Immunity boost. Lemons provide a potent immunity boost, helping your entire body function optimally and fend off infections and diseases. Artery protection. If you enjoy adding lemon zest to your meals, you're in luck. Recent research suggests that lemon zest is particularly nutrient-dense and excellent for protecting arteries from damage, a common progression of diabetes. In summary, warm lemon water first thing in the morning can improve glycemic control and insulin sensitivity, the core dysfunction in diabetes. Help burn visceral fat, which often contributes to diabetes in the first place. Boost immunity and flush excess glucose from your blood. Now, let's bring in our second superstar ingredient. It's another acidic powerhouse, and you might have guessed it, apple cider vinegar, ACV. This versatile liquid not only adds a tangy kick to your morning drink, but also offers a host of benefits for diabetics. We'll cover important precautions shortly, but first, let's acknowledge why ACV has been used for over 3,000 years. Like lemon, studies show that apple cider vinegar can prevent blood sugar spikes and aid in weight loss. For instance, researchers in Japan conducted a 12-week double-blind trial where participants consumed just 30 milliliters of vinegar mixed in 500 milliliters of water daily. Compared to a control group that drank plain water, the vinegar group showed significantly reduced body fat, BMI, waist circumference, and serum triglycerides, along with improved blood pressure. The researchers found these improvements correlated to a 10% reduction in the risk of coronary heart disease, simply by adding a little ACV to their water. And did you know apple cider vinegar is packed with vitamins and antioxidants? It contains B vitamins, crucial for delivering oxygen and producing energy your cells can use. Plus, vitamin E acts as a superhero, protecting your cells from damage caused by free radicals. There's also beta-carotene, the amazing pigment found in carrots, which your body converts into vitamin A, essential for healthy skin, mucous membranes, eye health, and immune function. As we've discussed, this morning drink can be incredibly beneficial, but there are a few important points to remember. Consume this drink each morning after brushing your teeth, and ideally 20 minutes before eating. This allows it time to cleanse your digestive system and organs effectively. It's vital to begin with a small amount and gradually increase it. Like starting a new exercise routine, you wouldn't lift heavy weights on day one. Give your body time to adjust to the acidity. Begin with half a teaspoon or less of apple cider vinegar and a quarter of a freshly squeezed lemon in a glass of warm water. You can slowly increase the ACV to a maximum of 2 tablespoons over several months. If you experience any discomfort or stomach issues, reduce your intake accordingly. Because both apple cider vinegar and lemon are acidic, they can temporarily soften tooth enamel. To minimize damage, drink through a straw and rinse your mouth thoroughly with plain water afterward. Also, don't brush your teeth immediately after consuming the drink, as this can exacerbate enamel erosion. When selecting apple cider vinegar, always opt for raw and organic varieties that still contain the mother. The mother is a colony of beneficial bacteria and enzymes found in raw, unfiltered ACV, which supports a healthy gut microbiome and aids in nutrient absorption. Organic ACV ensures it's made from organically grown apples, free from pesticides and herbicides. Mango leaf tea. According to many health experts, mango leaves have beneficial properties for diabetes patients. They contain several minerals and antioxidants, improving the cell's ability to absorb insulin, as well as regulate insulin production, thereby effectively controlling diabetes. Mango leaf tea is also considered a natural detox drink at home, supporting the treatment of various diseases. Drinking it before breakfast daily, alongside proper nutrition and regular exercise, has shown positive effects on diabetes management. Ingredients: 3 to 4 mango leaves and hot water. Preparation: boil the cleaned mango leaves for about 15 minutes, then let them steep overnight. Reheat the mixture the next morning, strain out the leaves, and add water if necessary before drinking. Beet juice. Drinking beet juice is one of the most effective ways to reduce metabolic syndrome, a risk factor for the spike in diabetes symptoms. Compounds in beets help control sudden blood sugar increases. It's recommended to drink beet juice once daily. Ingredients: 1 beetroot, 1 cup of water, and 3 mint leaves. Preparation: peel the beet and cut it into small pieces. Blend it with the mint leaves and water for 3 minutes, then strain and drink. If you are currently taking any medications, it's crucial to speak with your doctor first. Certain medications may interact with apple cider vinegar, and your doctor can advise if any adjustments are needed. Starting your day with warm lemon water and a dash of organic apple cider vinegar, remembering to start small and adjust as needed, truly is the ultimate dynamic duo for health and vitality. This elixir helps normalize blood sugar and insulin function, offers various heart benefits, boosts immunity, accelerates visceral fat loss, and promotes vibrant skin. Drinks to avoid in diabetes. Sugary beverages should always be avoided wherever feasible. They can contribute significantly to your daily suggested calorie intake and elevate your blood sugar levels. Sugar-filled beverages don't really offer anything nutritious to your diet. Let's get to know some of them. Regular soda. The first drink on the list of things to stay away from is soda. According to the ADA, a single soda bottle, 375 to 400 milliliters, can have an astounding 40 grams of sugar and 150 calories on average. Tooth damage and weight gain have also been connected to this sweet beverage. Pick fruit-infused water or tea instead of sugar-filled options. Energy drinks. Energy drinks may include a lot of carbs in addition to caffeine. A 2018 study found that there may be a rise in blood sugar with energy drinks. Sweetened or unsweetened fruit juices. All fruit juices include pure, natural sugar and can contribute significantly to your diet in terms of carbs, even though 100% fruit juice is okay in moderation and a great source of micronutrients like vitamin C. Make sure you get a 100% pure juice without added sugars if you have a persistent yearning for fruit juice. Alcoholic drinks. A small quantity of alcohol may initially raise blood sugar levels, and a large amount of alcohol might drop blood sugar levels, which is dangerous, particularly for those who have diabetes. Sweetened tea or coffee. Given its fluctuating sugar content, sweet tea is among the beverages that persons with diabetes should stay away from. Minimize sugar or syrups in hot beverages. Choose unsweetened options. By following these precautions and tips, this warm morning drink can be an excellent addition to the routine of diabetics or anyone looking to improve their overall health. Go ahead, give it a try.